Hi everyone, I'm Harrison, and this is Iman, Don, and Emma. And this summer, we looked at the descriptive epidemiology of dementia in the US in a new way, using specifically electronic health records. So, for some background, dementia is a progressive neurological condition affecting over 6 million people. And the number of people that dementia is going to affect is going to grow more and more. And so, as there's more people that are aging and more people that are getting dementia, it's critical for our healthcare system to know first who is getting dementia, and second, what are the characteristics of patients with dementia so that we can figure out how to get the resources that are needed to treat dementia to the patients that actually need them. And also to just simply know what's going on with dementia patients so that we know the best course of action to treat them. And so this summer, we used electronic health record data to try and get at both of these questions. This provides rich clinical information on a very large nationwide scale. And so this is the first time that we're really able to address both of these questions in a nationwide cohort, which made it a really interesting task this summer. Specifically, we used Truveta, which is a retrospective nationwide cohort of de-identified electronic health records for 120 million people, which is over a third of the US. And I'm going to pass it off to Iman to start talking about our results.
Here we can see patient distribution by age, and we can see that 5% of the patient were diagnosed with dementia before 65, because this population is not available in the previous data source. And another interesting finding is that more than 50 of the patients had a ACP score more than 5, which means they're taking two or more of drugs that have harmful side effect. And now I'll pass it to Dawn to talk about more interesting findings.
And what we are super excited about is our dementia trend and internal incident and prevalence from 2017 to 2024. And overall, it seems like incident, which is the red line over in that graph, seems like to remain stable throughout over the course years. However, the prevalence seemed to increase, and it seems like the reason behind the difference is because there's more and more people living longer with dementias, and which is a good thing, but also another point that we are also want to focus on is preventions, which I will pass it on to Emma to elaborate on our discussions.
Yeah, so like Dawn and Iman were talking about with our results, we were able to gain a lot of interesting insights using this data. And it's especially exciting because, to our knowledge, we are the first people to be able to characterize dementia through EHR data. And more specifically, we've been able to get much more clinical information to create this clinical profile. So things like lab measurements and medication information are a lot of new and novel insights that we've been able to derive, as well as cases of dementia diagnosed before age 65, which previous cases, as Harrison mentioned, were not able to incorporate. So we've been able to look at a lot of new demographics as well as new clinical information. So our results have shown that overall, a lot of patients are living longer and longer with dementia, but this also tells us that early intervention is possible, and especially when it comes to modifiable medication risks that can be prevented with safer prescriptions and public health policy and resource allocations. This gives us a lot of interesting information to work off of. And so going forward in the future, our future work will look at data outside of the Truveta platform. So platforms such as Epic Cosmos would be an interesting next direction, as well as using these frameworks and definitions and code lists we've been able to make over the past few weeks and applying that to related other projects that have to do with dementia and other public health topics. So that is a bit of the work we've been doing this summer, and we've been very excited to share this all with you. And that's all for our poster. Thank you for listening.